Hi, Dr.smell-Bell-verbal ENT interesting facts. Please do subscribe the videos if you like the videos. Today I am going to deal about the anatomy of the hypopharynx. Hypopharynx is in between oropharynx and then esophagus. Oropharynx superiorly and esophagus inferiorly. And larynx is located anteriorly. So larynx is located quite anteriorly to the hypopharynx. Larynx in front and then oropharynx superiorly and this esophagus inferiorly. Inferior limit is the esophagus. So from the hyoid bone level, which is at the C4 cervical vertebrae, from the hyoid bone level, which is at the C4 cervical vertebrae, for example C4 cervical vertebrae hyoid bone, to the lower part of the cricoid cartilage, which is at C6 level. Lower part of the cricoid cartilage, which is at C6 level. The cervical esophagus extends from the lower part of the cricoid cartilage into the thorax. The cervical esophagus extends from the lower border of cricoid cartilage into the thorax. Lower border of the cricoid cartilage into the thorax. So lower border of the cricoid cartilage into the thorax, the cervical esophagus extends. Hypopharynx includes three parts, that is pyriform fossa, posterior cricoid region and posterior pharyngeal wall. Pyriform fossa, posterior cricoid region and posterior pharyngeal wall. Pyriform fossa, posterior cricoid region and posterior pharyngeal wall. So the lining of the mucosa is just like this, like innermost, that is the mucosal layer, stratified squamous epithelium, mucosal layer which is the stratified squamous epithelium, and second layer is the pharyngobasilar fascia, as you know, pharyngeal aponeurosis, pharyngobasilar fascia, and third layer is the muscular layer, and fourth layer is the buccopharyngeal fascia. So from inside to outside it is MPMB. So mucosa, pharyngobasilar fascia, muscular layer which includes superior, middle and inferior constrictor muscles. Superior constrictor muscle, middle constrictor muscle and inferior constrictor muscles. So this inferior constrictor muscle has got two parts. This inferior constrictor muscle has got two parts. So oblique thyropharyngeus, transverse cricopharyngeus, which has got a gap in between called as Killian's dehiscence. This inferior constrictor has got Killian's dehiscence in the middle. And then cricopharyngeus muscle is the lower border of the cricopharyngeus muscle, hence the hypopharynx. So pyriform fossa has got a superior membranous part and then a lower cartilaginous part. Superior membranous part has got lateral border as the thyrohyoid membrane. Superior membranous part has got lateral part as the thyrohyoid membrane. So this pyriform fossa, superior membranous has got lateral part as the thyrohyoid membrane. This superior thyrohyoid membrane, it innervates into which the sensory branch called as internal branch of superior laryngeal nerve, and sensory innervation synapses with jugular ganglion along with Arnold's nerve, which is branch of vagus. So the patient has got otalgia with the help of this sensory innervation when there is a pyriform fossa tumor. Next is lower part, which is of by the ala of the thyroid cartilage. Lower part is the ala of the thyroid cartilage. So wherein which is pierced by the recurrent laryngeal nerve and passes through the cricopharyngeus muscle, the posterior cricoarytenoid muscle and posterior cricoarytenoid muscle. Posterior cricoarytenoid muscle and cricopharyngeus muscle. Posterior cricoarytenoid being the chief abductor of the vocal cords. Motor and sensory innervation is by means of pharyngeal plexus, and pharyngeal plexus, that is by means of 9th and 10th cranial nerves. Motor and sensory innervation, pharyngeal plexus, 9th and 10th cranial nerves. Okay. Next is the superior thyroid artery is the blood supply. Superior thyroid artery is the blood supply. Inferior thyroid, ascending pharyngeal and lingual also give some supply. And lymph nodes are by means of hypopharynx to 2, 3, 4 levels, and to a lesser extent to the spinal axillary nodes, and very less amount of supply to submandibular 1B level nodes, and also to the retropharyngeal nodes.